Да, есть, да? Hello, dear colleagues. My name is Mynzhylky Berdikhojayev, and together with my assistant Abzal Jumabekov, we're planning to do this cerebellar AVM case. Patient 30 years old, previously ruptured with ataxia, hemiparesis, and we did 2 sessions of embolization, and on angiography now you can see there is a small feeders from mostly SC territory, might be some perforating branches. We see the same, Abzal did the angiography, yes, mostly the SC territory. And now right carotid system clear, no PCOM, small PCOM, but it's not covering the AVM territory. Oblique view. It's clear. It's clear. It might be something from the cerebellar, but on this image we couldn't see mostly the PCA territory. And the left side the same. Last time it was some branches coming from the external circulation, but now we see it looks like clear. Maybe we need, okay, Abzal did a small selective imaging. It's some small feeders coming to the AVM, but not clear fistula. I think the small something might be from this external carotid system. Okay, it's not so much. Tentorial branches also from the meninge tentorial. Maybe something is going very small, and there is a aneurysm, should be something coming from the ICA territory and mostly from the superior cerebellar. Okay. Abzal did a single rotation. Usually better to do double rotation. Okay, this is CT. Okay, let's see. From the right side, we clearly see the upper part of the AVM and the single draining vein, big caliber. The meaning is this, we did most of the part of occlusion of the AVM, but still it's feeding, and the vein caliber is quite big. And if you notice, the straight sinus is stenotic. That's why cortical drainage is working, because of this straight sinus stenosis. Okay. Yes, it's one of the way of transvenous approach. Maybe next time we will do transvenous, but this time still vein is with big diameter. Okay, let's see the left injection. Yes, the basilar is mixing from right side, and it's done from subclavian. Maybe more selective image will be clearer. Okay, something comes from the ICA territory and mostly from the SCA. Okay, let's check the ICA and PICA. Mostly ICA. Okay, let's see the This is control CT. Yes, it's in the cerebellar pontine angle and in mostly in cerebellum. The option number 2 is gamma knife, maybe. Option number 3 is resection. It's possible to resect the part of hemisphere of the cerebellum and take out the AVM. Also possible option. Okay, let's open sonic. Guiding is narrow max 8 French. It's good. I think headway duo we don't need, but we will prepare. Sonic надо koyuyorsunuz. We don't need, but we will prepare headway duo. In some cases we need it. Okay. Sonic 1.235, Sonic 1.225. Two Sonics we will open. Okay. We will open both Sonics. The diameter of the feeders is not so big. That's why I think it's preferable to use just single microcatheter. As you saw yesterday, it's also possible to do with the coiling and waiting for several minutes and then it starts occluding. No, 수복화하면? No, 수복화하면? 네, 신었어요. Абзал бичиш, маған жол қойып жіберсеңші. Маған жол қойсың. Қойға? Маған жол қойсың. Келесің. Ашып жіберсің. Окей. Давление сәл төменде болып тұр ғой. Yes, it was clear and now it's a little bit dirty, but it's okay. Так, екі шприц ашасыз. Уақыт. We will prepare two set of syringes. Так, мынау қайда отыр?
Сол жақ позвоночник отыр.
Позвоночник кірді ғой, да?
Екі.
Yes, my name is Mynzhylky and this is Abzal. It's quite fast. Давлениесі бір үрлеп қоясаңыз. Okay, I will change to prevent the finish of this saline in the прыжков in the flashing system. Okay, we asked for both sonics. One sonic is 1.235, the second is 25 with the 007 hybrid, which come in the same box. Yes, this is a presidential hospital in Almaty, Kazakhstan country. And today is Sunday, 23rd of February, and I was born in Soviet Union in 1981, and at my time it was a weekend's vacation day because of Soviet Army Day. It was in previous time, and nowadays it's just a memory of Soviet time. And the day of Kazakh Army is the 7th of May, but we still say, okay, congratulations with the Army Day. It's 35, and the second one is 25. Yes, Abzal trained in November and December in Japan, and now we have this system. He's covering the monitor with some material. Yes, it's good. It's international practice, and thanks for the team of Professor Yoko Kato. They're changing the practice really. Okay. It's so-called academic approach when you're doing something in a best way. It's good. Назад. Так, now what's the best, да? As 35 we will send through the straight Y connector, and the second one we will send from the this one. Okay, this is 35, and this will be 25. Yes, I don't know why the bulk distributor nowadays ordered a lot of 25, and usually it's a practice of other hospitals in Kazakhstan, but in our practice it's usually 1.5 35. It's more similar to Apollo. In most of the cases, 90% it's okay. But yes, different hospitals has different approaches, and unfortunately the stock in Kazakhstan is limited, and then we should work with the order of other colleagues. But for me it's not so comfortable to work with the short microcatheters, short tip microcatheters. Yes, it's in several products the same situation. With coils, my colleagues using mostly short coils, and we're using mostly long one. Назад. Mostly using long coils. It's a difference in approaches and practice. Okay, no problem. Couldn't see my flashing system. Сәл бері айналдыра салсаңшы. Okay. Жоқ спираль керек жоқ. Так, 2 дмс жинап қойды ғой, да? Экранды 20 сантиметр аяққа тарта салыңыз. Yes, I'm sorry, but we used to work in this condition. I need a close 4 monitors to see clear. Yes, now we are in V3 segment with the 35. Now it's at 25. Ой, ёб твою. Something happens today with these Y connectors. I don't know why. It's all the time I'm pushing it. Okay, I will close this to prevent same mistake. This is Neuromax. Neuromax is quite soft guiding catheter. We put it through the 8 French short sheaths. It's our regular practice. And now the microcatheter in basilar artery. Kas bir sekund. Okay, let's do a little bit oblique view. Palm projection. Maybe this is better to see more clear the basilar artery. Okay. Lateral view I will do a little bit smaller. Yes, we need to see all basilar. Now I hope it's clear. And with tantalum... жоқ, талон перфорант бармайды. Жоғарыда ғой. Okay. Yes, mostly we will use lateral view. AP is not so clear. I think there is perforating branches from basilar. It became bigger. Stop. Назад. Ага, it became bigger, and it's a problem of arteriovenous malformation. Because of the flow, the small branches became bigger. Okay, in this system I think we need to use it is 35. Okay, let's go with 35. On AP there is no information. Just a second. Oh? Держи, держи. Absolutely. Oops. The syringes from Squid is quite slippery, that's why it's a problem to control. Yes, it's a perforating branches, and I'm not sure we need to work from these branches. It's quite short. It's ICA on the left side. I will bring my microcatheter a little bit proximal. Maybe something will come from this point. Yes, there is something bigger. Stop, назад. And it's not clear where it's come. Just a second. This is not clear. I think we need to do like this and like this. Maybe now it's more clear. I will increase a little bit the radiation. Okay, now we are in basilar. It's a big segment, huh? It's going up. It's going up. Okay, I think we need to go with the 25. Smart mask closer. Oh, we should. I think we need to go with 25. There is another branch. Okay, let's check. Okay, it's quite small. Oh, it's our branch. It's Aika on the left side. It's going down. Yes, sometimes for the catheterization of these branches we need a balloon assistance. Not so frequent, but it's needed. It goes somewhere, huh? Okay, let's check. Let's check where we are. Низкий эксплуатация. Yes, it's close to the AVM and fistula. Maybe then we need a couple of coils, huh? Okay, let's wait with this. Now бірінші проводник берсеш. Maybe we should check tartma. We should check pica territory also. Okay, I will go down. There should be something here. Okay. Let's do Mynzhylky. And there is aneurysm at the orifice. Eh? Okay, let's check the 3D. No, sol жағына қойды.
No, оң жағына.
It was from the right side. Okay, just a second. This is from left, I think.
Yes.
Yes, there is an aneurysm at the orifice. It's quite fusiform. Maybe at one point we need a FD. Okay. It's a quite small branch, huh? Так, okay, now we are quite safe. We passed the aneurysmal segment. Okay. It's inside the aneurysm. It's okay. Yes, it's inside the aneurysm. Okay. I think it's touching the aneurysm, and usually the catheterization of pica not so problematic. It's inside the aneurysm. Okay, now we are distally from the aneurysm. It's like small branch here. Okay, now we went up. We need the angiography from this point. Big branch, yeah. It was looked like some bifurcation, but on this image we can see the most of the flow is going to the AVM, not to the cerebellum. Yes, it's going to the AVM. Ну-ка, назад, назад, назад. Ага. Вперед. 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 Стоп. Условись от мозга. Okay. I think we need to go as much as distal. Okay. This one. Yes, you should know it's very close to the brain stem, and the small and visible branch all the time may go from this segment, and it might be quite challenging to work on AVM like this. I needed more smaller curve, that's why I used the technique I learned from René. Okay. we little bit pulled the microcatheter. That's why at the time of navigation I need to little bit push the microcatheter. Okay. Now we're in the feeding branch. Maybe we're quite distal. Okay, I will pull a little bit. Push more. It might be small branch. Okay. And also the other point, those vessels are quite fragile, and all your small movement may cause big problems, and that's why we prepared dimethyl sulfoxide, DMSO, on the table. In Europe, in many countries, all the time NBCA on the table. That's why the colleagues usually ready to inject. Okay, it looks like there's a quite big feeder distally. We can go a little bit more, or we can inject from this point, but it's quite close to the V4 segment. What to do? Abzal, what to do? A little bit further. Okay. Put the smart mask, and then we can try to go a little bit distally. 5 millimeter. Maybe after that we will ask for headway duo, and maybe we need to take headway duo and place a couple of coils a little bit proximal to be in more safe projection. As I became older and older, my myopia now looks like hypermetropia. One of my colleagues nowadays has a cataract, vascular surgeon, and he's preparing to replace the роговицевый вот. Yes, artifacie. He's preparing for the artifacie. Okay, now we are distally, but not all the time. The microcatheter should go the same direction. It's quite tight angulations. I will try to do maximum from what we can do from this position. Okay, it's quite at the same level. Okay. Yes, to push distally we need to wire distally, but in this tortuous anatomy I will not to take additional risk. Okay, it's again in basilar. Okay, we can place headway duo proximal, and we can go with the coils. Okay, just a second. Okay, we'll work from this point, and now headway duo. Yes. It's possible to go distally, but it will take some effort, and at one moment it's possible also to rupture the artery. That's why maybe sometimes better to place coils and do pressure cook with the coiling, and to stay in a more comfortable position. Yes, and when the experts trying to judge the treatment, they say, okay, this is more complex, more complicated pathology, you shouldn't do it. Yes, and I hope it's also the point of view, the procedure should be safe, but at the same time, not all the treatment could be at the same safety position. Sometimes it's better to go distally to save more brain, but at the same time, if you have more strict experts, then it's better to do it more proximal. More proximal, and then your catheter navigation is more safe, but the position of the distal microcatheter is not so safe. Yes, there is a lot of dilemmas, and I think the all colleagues are experiencing such a feeling when they deal with the endovascular treatment. Yes, it could be more safer to stop at one point and has less complication, but has incomplete treatment. But incomplete treatment is safe treatment. Huh? At the time of treatment it's safe, and during the follow-up maybe it's better to take a risk. Yeah, it's a philosophy. It's all the time philosophy. Okay. You put navigate and smart mask first. Okay. Let's try with the how do we do it? There is a small feeder from V4 segment. Yes, now it goes more smoothly. We should keep in mind the anatomy of pica is a little bit changed after placement of sonic. It's not the same image as we saw before. Now is the same branch. Yes, headway is a little bit stiffer microcatheter. At the orifice of pica there is already microcatheter. It takes on the fourth, huh? Sometimes you need to push with hand the microcatheter. Yes. It's not the same easy way. Назад, чуть-чуть. Okay, stop, назад. There is some branch from SCA also, from ICA, or close to ICA. It's a little bit down to ICA, and I think there is also a branch. Okay, I will try to go. Okay, now we can pass the point. I did a little bit pull to have ability to push, but at this point it's quite tortuous. Maybe we need to stop at this point. It's a quite stiff microcatheter. Okay, this is a microcatheter number 3. That's why we put 3 Y connectors. Okay, let's check. And now we will prepare the coil. I hope this all is veins. It's not the branch for period. It's not the branch for brainstem. It's a vein. Yes, it's a vein. Okay. Microplex podziałem tort? Yes, we're asking for microplex 1.5 by 4. I think a couple of coils will be okay. Tak, берем sans. Ja, schön. Yes, and as we commented previously, we have no glue available in Kazakhstan. That's why we should work in this manner. Just coil and wait for several minutes, and then coil start thrombosing. Так, анаған микроплекстің отделокс кигізіп алайық. Мына ашып кетті. Керек жоқ. Жоқ, болмайды екен. Жыртылып қалған. Қолына ұстай салыңыз. Okay. We will ask the Clever Company. Clever Company is a partner of Microvention, distributor of Microvention, and maybe we'll ask them to do some package for V-grip to do it possible to use second time. I hope they're watching this video. Yes, for this one we need some kind like a condom, sterile condom. Okay, now coil is detached. I will ask Abzal to pull it. Okay, pull. Yes, something like package for the V-grip and the detacher of Optima, the same size. If you're watching this video, please do it. Yes, the Clever Company has the own manufacturer of all this stuff in Kazakhstan, and they can change everything in quite a short period of time, and we are working for long time. Huh? Okay. Per second. Sometimes we need the saline with the natri chloride. Yes, then it's working. Okay, now it's detached. Yes, yesterday we couldn't detach one coil, and we finally retrieved unexpectedly, and today it's detached without any problem. Then we have a second microcatheter in SC ICA, and I'm not sure it's possible to do the same in ICA territory. Okay, there is something going quite small and yes, quite proximal, and we don't need to occlude this branch. It's also can fit the cerebral medullary angle. Yes, it's right. Okay, let's wait with this microcatheter. It was this, I think, yeah? It's a quite preparation. Yes, it was this one. It's the same vein, same big vein.
And this one also is a downside. Downside is also
Downside is a vein, yes, it's a vein. You can see on AP, it's going to the draining vein. Spirit? Yes, it's a vein. Yes. I think we can occlude this one first with this very short reflux. Так, назад, backward, forward. It looks like we can go distally, but I'm not sure. What it looks like. We can go and place one coil, huh? There's a quite tight angulation. Okay, let's take this. Жанах проводник вирисал. Жанах проводник вирисал. Сонг проводник вирисал. Okay, we will take out the headway door. Посмотрите. Okay, let's check. Yes, this one we used for the navigation. I will do the angulation. When I studied in St. Petersburg, the Bible and icons was set on the door, and for me it was quite interesting. But nowadays we are listening for surah, and I think it's a good practice. It's not everything in our hands, and sometimes we need support from heaven, yeah? From God. Okay, the same artery. Okay, let's try to go. Headway door is a little bit stiffer than the sonic, and okay. It's not going, huh? It's stuck with the sonic at the same level. They're stacking with the sonic, and I could not push it forward. Maybe it's possible with the Traxxas, huh?
Yes, maybe.
Oh, no, it's went. Okay, that's good. I'm moving with simultaneously at the same time. I need to go up with my, how do I do? It's better to go up. If it will go, it's very good. Okay. It goes down. It's a quite big angulation, that's why it's a little bit problematic to push it. Maybe we'll use it just for control angiography, not for coiling. Okay, let's check. So, observe. Okay, then we can use Cerebellar Black for navigation. It's a quite big branch, huh? It's a quite big branch. Назад. It looks like it's possible to push a little bit more, huh? Just a second. I will try to clarify the situation. It looks like we can push forward. Okay, let's try to push a couple of millimeters. Okay, looks like closer. I think we need to use the last one. It's better. Yes, there is also Traxxas 007 James Bond Traxxas available in Kazakhstan, but not available today on the shelf. We used several times, and the navigation with Traxxas is very smoothly and easy. Okay, let's see what we can do. Even from this point we are trying to do our best. It's going to different direction. I will try to push it without wire. There is a connection, and it's also the problem of this navigation. Okay, I think this point is okay, no? Abzal, what is your opinion?
I don't know.
Even me too don't understand. It's there is a lot of material in between. Okay, let's try to change it. Okay, now it's more clear, huh? On AP it's more clear. Maybe we need to do as much as possible lateral. Okay. Let's try to do this one also. This one is more clear. Okay. Let's check it. Oh, there is angulation again this direction. вперед, вперед. Стоп. Стоп. Угу. Да, угол горла. I think it was this angulation. Osman, назад хочешь? Смотри. Угу. Стоп. I think it's not the same branch. I will try to push it as much as possible. Huh? Yes, it's quite short. Okay, I'm not sure we need a complication. And now we will inject from this point. We have a headway duo for control and nearly 2 centimeters of sonic in the branch. Okay, let's start with this branch and then we can go with the go with the 35 for quite longer injection. Наркоз поглубже, дексаметазон 12. Yes, it's a small branch. Huh? It's a quite small branch, but there is another branch also available. I will not pull it, we'll leave it in this projection. And there is a draining vein and okay. Is it extravasation? This might be something like extravasation, huh? Maybe inside the vein, huh? Demosol? Squid? Okay. This might be everything, huh? It's quite a small branch and after injecting first drop we can pull it a little bit proximal. Oh, it's look like AVM. Okay, it's a squid 12. Uniковый, да? Squid 12. Okay. It's very important to not to bring the microcatheter. If there is some unexpected things, then it's better to be in the hole of something. Then you can inject, and after it's in the venous part. There is no extravasation. It's just the vein. Yes, we are in the vein. Yes, it's in the draining vein. It's a small fistula going directly to the arterial part. I'm not sure what's this, and that's why we will bring it a little bit proximal. Okay, now it's better. Now it's more bigger branch. Now it's refluxing, and I think at this point we can stop. When it's not understandable, then it's better to stop.
Come on.
It's all the time stressful to do this kind of things. Yes, and the headway duo is in place. Yes, everything is clear. The branch is occluded. Did it? Okay. Now we are in safe position. Yes, it's occluded. No leaking. Small AVM could be remaining, but no problem. Так, промывку вырисешь? Ой, коннектор. Първо коннектор ми промывку вырисешь? Ана, столница неговой коннектор вырисал. I will put flashing on the headway duo. We'll leave it in the basilar artery. We don't need to use this headway duo, but we will keep it there for any emergency. And now we have only sonic in pica territory. Okay, now it's possible to go to the AP. Okay, this like this and this like this. Yes. I will take it a little bit proximal to prevent the mistaking. Okay, let's check. Okay, now it's less clear. This position is more clear. Okay. Yes, it's the beginning of the draining vein. Okay, let's start. We placed a couple of coils proximal. It's a modification of pressure cooker. Just with electrically detachable coils. Екіншісіне полный шприц жинап қоя сал, абзал. Полный шприц жинап қоя сал. Okay. I will put this image on control. Like this. Glue the radiation on 2, as the reflux will control on lateral, and the squid progression we can control on AP. Now it's quite fast reflux. It's another branch, huh? It looks like it's artery. It's more medial. It was not this branch before. Huh? We couldn't see it. Just a second. Немен хедвеймен жасаған ангюдан қарайсаш. Yes, it could be some branch from the brainstem. Could be collateral coming from somewhere. Maybe it's a branch coming from the ICA. Okay, we don't need to go frontal. It's enough. Okay, it's going this direction. Медиан хедвейден проксимально жіберген көресіз? После спирали. Көрер. Ага. Жүр, дальше. Чуть выше. Спираль саған кезде. Дальше. Выше. Жоғары. Ну-ка, вперед, стоп. I'm not sure. It's look like vein. It's look like vein, but on liquid injection, it's look like artery. Yes, it's look like artery. Не видиш? It's a vein, yeah? No, it's not vein. It's a basilar artery. Okay. Базилярный рефлекс живота. I think it's a branch coming from above. Последний ангел интересуешь? Кнопками баснешь будет. Назад. I think it's one of these branches going this direction. Yes, скорее всего. Yeah, it looks like the branch from the artery above. It's around the brain stem, that's why I'm not hurry up. I'm not pushing it so quickly. Okay. Let's wait. It's going backward a little bit and mostly forward. Хайсан. Остросонс. Бар ма? Yeah, it's very important to have a team working at the same direction, same wave, and to make the treatment in a team manner. It's very important. And in many hospitals, the team is changing during the day. It's also the same in Astana Presidential. Our team is changing 3 times during the day. I think it's a reflux. It's look like it's a reflux. No, it's not reflux. Something goes forward. I'm not sure. It looks it goes to the AVM direction. Okay, I will ask Abzal to control this branch. And I will focus on AVM. But also at the same time I need to check and control this branch also. Yes, it's going forward. Okay, let's wait a little bit. Yes, there is no flow anymore from pica. and I hope the aneurysm will disappear quite soon, and if there is no flow, aneurysm could disappear. If not, then we will coil it. Yeah, there is a branch proximal feeding the cerebellum and brainstem. Так, назад. Also the ICA is working like ICA-PICA. Вперед. Yes, one of the branches from the branch below going to the cerebellum is also feeding this territory. Maybe it was the arterial collateral we occluded now. Вперед. Yes, now this monster is more understandable, huh? Okay. I pushed a little bit hard. It goes forward also, but mostly to the AVM. Okay, let's wait a little bit. Kıyasar. Stop. Ну, хэт рып цэйсэл. Собственно, жинады ингизэжинэс. Жарцна жит ингизэжинэс. Okay. Let's wait a little bit. Not an easy case, huh? Not an easy case. Yes, the one more option to place this that we do to the branch from the brainstem below the anterior inferior cerebellar artery, but it will need one more guide, micro guide wire. Okay, it went forward. Maybe we'll go for this branch. Бахыт. Чикай black бересеш. Okay. For more stability and navigability, I ask Chikai Black. Salsa. Yes, I will inject one more time, and then we will change the roadmap mode for navigate, and I became older and older. Huh? It's not possible to work 100 years. Huh? There is a problem with knees, there is a problem with lumbar spine, problem with eyes. Then you need to retire and open the place for younger generation. Yes, it could be joke, but it's a part of life. Huh? It's not workability for forever. At one time we should stop. Okay. I think something here. Okay, just a second. I will inject one more time. Let's inject. Yes, it's going backward. Последняя ангиография Berdikhojayev. Let's do smart mask. Okay. Yes, this branch. It's exactly the branch I want to go. It was look like something coming from this territory. Oops, sorry. It's a headway duo with the checkered black. Yeah? It's the beauty of headway duo. It's possible to use. Yes, this territory. Yeah. Okay, I think for the next time we can use this artery. And this branch came from here, no? Period. It's a big branch, huh? It needs some time to inject. If we will go forward with the reflux, then we can occlude this branch. Then it will be useless. Okay. The course of this branch is a little bit unclear, but I think next time we can use a balloon distally and then go with the sonic. It's possible. I think for the next treatment it would be the one of the branches to go. Так, glue. Yes, we'll control with the headway duo. Yes, it's stuck. Okay. No, the microcatheter in trouble. Yes, when you wait longer, then it may stuck, and then you could not inject. It's a problem of mostly Sonic 1.2. Okay. Then we need to keep in mind there is an aneurysm on the way. Stop. The beauty of these ball-to-eye connectors, I can feel the pulling pressure. Okay, let's wait. We can leave it with no problem. Oh, it's detached. Yes, this is a branch for the next time. It looks like we occluded some part of this branch. The navigation could be a little bit problematic. It was collateral from this branch. Okay. Maybe small drop of glue could be an option. Okay. It's close to brainstem, that's why I will not take a risk of injecting something. Yes, there is an aneurysm. I hope we don't need to do anything with this aneurysm. Yes, usually they're disappearing. It's a fuzzy form. Okay. Назад. The most territory coming from the SCA, and now this AVM looks more eatable, huh? Eatable, yes. One more session with this branch from the basilar, and then we can go to the SCA, and the last session, last session we can go from the Venus side, yes. Okay. I think we can finish. No need to push the treatment. We have time, we can wait. The other problem is venous thrombosis. When you do quite aggressive embolization, then other problem is coming. The other problem is thrombosis in the venous side, and it's also the other kind of complication. It's all the time problem of balance. We need to balance between arterial and venous complications. Okay, let's do control CT. The next case is stenosis for the patient after bypass. There is an interesting case. It's an ICA occlusion, and the bypass was done, but the stenosis now goes to the external carotid artery, external carotid, yes, and it's critical stenosis at the orifice of external carotid. And today we are planning to do stenting for external carotid, for the bypassed branch. Okay. Let's wait for the control CT, and then we can wait for 30 minutes and next case, and after carotid stenting, 20 секунд per spot. After carotid stenting, we have another one, brain AVM, callosal one. Let's wait. Kas bir sekund. Okay, dear colleagues, now we've finished the expert CT. You can see everything is clear. The part of cast of the liquid embolic in the partially close to the brain stem, and yes, the brain is clear. The lateral ventricles are clear. The upper part of the brain is clear. This is something in draining vein and part of AVM. and lower part is clear. Okay. Now we can finish and see you in next 20-25 minutes. See you. Thank you.